Hello, it's Carma Connor-Marroquin here, and I'm a retired U.S. Public Health Service officer, and I'm going to talk a little bit today more about the U.S. Public Health Service. I'm going to go through this Public Health Service fact sheet to share more information about the service where I worked for 14 years. So in this picture, you can see uniformed officers there in Washington, D.C. in several of the different uniforms that they wear. You see the service dress uniforms, you see the whites, and then you see the khakis. So a lot of times the U.S. Public Health Service officers are confused with Navy officers because of the similarities in the uniforms. The Public Health Service has a rich history, and since 1798, men and women have served in the front lines protecting our nation's public health in what is today known as the Commission Corps of the U.S. Public Health Service. We trace our origin to the U.S. Marine Hospital Service, implemented to protect against the spread of diseases from sailors who return from foreign ports and maintain the health of new immigrants. A little more about the history is that Public Health Service officers have worked on Ellis Island when they were offering or providing health exams for immigrants. They also worked on Alcatraz. And in modern day times, officers are still serving in similar roles in deployment missions, servicing unaccompanied minors on the southwest border, and working at the Bureau of Prisons. So who are we? The Commission Corps of the U.S. Public Health Service is one of the 8 uniformed services and is the only one dedicated solely protecting America's public health. So there used to be just 7 services until the U.S. Space Force was added, but there are 8 uniformed services: the Army, Air Force, Navy, Marines, and Space Force, along with the National Oceanic and Atmospheric Administration, the U.S. Public Health Service, and the Coast Guard. So the Public Health Service is led by the Assistant Secretary of Health and the U.S. Surgeon General. They're composed of nearly 6,100 full-time, highly qualified public health officers, and the specialties include physicians, dentists, nurse, pharmacists, clinical and rehab therapists, dietitians, engineers, environmental health and health service officers, scientists, and veterinarians. So what do? They protect, promote, and advance the health and safety of our nation by providing essential healthcare services to underserved and vulnerable populations. They deploy for public health emergencies. As the cornerstone of the U.S. crisis response, officers deploy to natural disasters like hurricanes and earthquakes, to any kind of a disease outbreak. They've been active with the COVID pandemic and any other global public health emergencies. And then they serve on humanitarian assistance missions as well. They lead public health programs and policy development. Officers leverage their extensive experience, skills, and networks to provide expert leadership within the Department of Health and Human Services and throughout the federal government. They advance innovation and science. The clinicians and research scientists work at the forefront of the battles against COVID-19 response, Ebola, cancer, food safety, HIV, mental health, and more. So that is a brief overview of the U.S. Public Health Service and what they do. You can learn more about that at www.usphs.gov. And I have a bit more information that I'm going to share on another document. Now, in this document, it's called 8 Steps to Become a U.S. Public Health Service Commission Corps Public Health Service Officer. So there are some steps involved. And one thing I'll say about the process of becoming an officer in the U.S. Public Health Service is that it's not for the weary. It can take sometimes up to a year or more to apply to be an officer in the U.S. Public Health Service. So the steps they have outlined here, they say there are 8 steps. The first is to visit USPHS.gov to gather more information, and that is where you would apply. To apply, you select the Apply Now button and then register as a new user for the system. They call it the Application Enrollment System. The next thing you want to do then is create and activate your account. You'll activate this account by clicking on the link that you received from the email address aes@hhs.gov. At that point, then you start your pre-screen. You complete the pre-screen to determine if you meet the eligibility requirements for the type of application that you're interested in. The next thing you do, step 4, is submit the required materials. In your email, you'll receive a detailed application checklist, and so all the required documents would need to be submitted. Sometimes, if there's a need for a waiver, you would need to submit that along with any supporting documents. Step 5 is the interview. You'll have an interview with a professional appointment board, and that'll include senior ranking public health service officers from your professional category. If you clear that interview, then you'll be submitted for a nomination. Then on to step 6 is to complete 3 commissioning requirements, and that includes your medical, security, and nomination clearances. At this point, you'll receive an email to start the medical clearance process, and then there's an email to follow through with questions at CCHQ helpdesk at hhs.gov. It's important that when you're notified of the next step that you take action right away. Then we move on to step 7, seek employment opportunities with federal agencies. It's at this point that you can start searching for a job. So unlike the other branches of the military where they dictate where you live and what you do, with the public health service, you get a choice in where you live and what you do. But the downside of that is that you have to find your own job. So you can visit usajobs.gov or contact the chief professional officer within the specific category that you'll be in to get a list of vacancies or other employment opportunities. And then the final step is to be called to active duty. If you're offered a position, your hiring agency will coordinate with headquarters, and any final requirements are verified in order to get you called to active duty. So once you accept the offer, then your official orders are issued and you're called to active duty. And then the next step is to attend the Officer Basic Training course, which is 2 weeks long. So if you have questions or need further assistance, you can always contact the call center at 1-888-225-3302 or send your email to cchelpdesk at hhs.gov. For people who are in the military or active duty or reserves, and you have specific questions related to an inter-service transfer, you can email phsist-assist at hhs.gov for help with that. So there you have it. There's the overview of what it takes to be called to active duty with U.S. Public Health Service. If you're interested in taking a quiz to see if you would generally qualify to apply for the U.S. Public Health Service, I have a link to that here at this YouTube video. In the comments of this YouTube video, you can take that, and it's not the official pre-screening tool, but it'll give you an idea on whether or not you would be eligible to apply. If you like this video, please like it and share.